because even though we're in the era of patient-centric care, a patient can still sometimes become a bit nervous or even forgetful when confronting a white coat in a doctor's office for an exam or a consultation. So, in order for patient-centric care to actually occur, there needs, to your point, to be a keen understanding by the beneficiary, by patient. And that first and foremost includes an acute understanding of the patient's treatment plan.
Hello, and thank you for listening to the HOCO Health Podcast, where we discuss topics related to all things public health. I am Howard County Health Officer Dr. Maura Rossman. During today's episode, we will discuss health insurance access and patient advocacy in Howard County. We'll also review some of the programs available in the community to assist families with access to affordable, quality health insurance and equitable health care. Why is health insurance important? Health insurance protects you from unexpected high medical costs. People without health coverage are exposed to these costs. This can sometimes lead people without coverage into deep debt or even into bankruptcy. According to healthcare.gov, the average cost of a 3-day hospital stay is around $30,000, and comprehensive cancer care can cost hundreds of thousands of dollars. Having health coverage can help protect you from high, unexpected costs like these. In 2021, Howard County Health Assessment Survey showed 7% of Howard County residents reported not having any kind of healthcare coverage. This includes 22% of adults between the ages of 18 and 24, and 12% of adults between the ages of 25 and 34. 17% of residents who earned less than $50,000 also reported not having any health insurance. So health insurance is especially important for our young adults and those entering the workforce who may not yet have high incomes. At the health department, our role is to assist people with navigating the health insurance landscape to locate the coverage that is appropriate for themselves and their families. This can include signing up for private health insurance through the Maryland Health Exchange or determining eligibility for Medicaid or another medical assistance program. Access to affordable health insurance and affordable quality health care is a critical social determinant of health. But we all know the system can be difficult to navigate, especially if English is not your language, or you don't have a PhD or an MD to understand health insurance terminology. Luckily, our staff at the health department and staff at the organizations we partner with, like Healthcare Access Maryland and Maryland Medicaid, do understand the complexities of the system and are ready to help you filter out the noise to locate the most appropriate coverage for you and your family. Now, I would like to introduce our first guest, Ms. Allison Hooley. Allison is the Deputy Director of our Bureau of Access to Healthcare and currently oversees the Medicaid programs within the department. Welcome, Allison.
Thank you. Thank you for having me.
Allison, do you want to tell us a little bit about yourself and your work at the health department?
Of course. So I'm currently the Deputy Director of the 3 Medicaid programs here at the Howard County Health Department. Throughout the state of Maryland, each health department has 3 Medicaid programs. That's your Administrative Care Coordination Unit. That's a program that helps clients access their different coverage. There's the MCHIP program. That's probably the more well-known. That is where you come to apply for Medicaid coverage and learn more about your Medicaid coverage. And the third is the Medical Assistance Transportation Program. That's a transportation program offered to Medicaid recipients throughout the different county. And I've been working for the health department, first in Anne Arundel County, and then here at Howard County for 11 years now.
Wow. So you bring lots of experience discussing Medicaid programs. But before we do a deeper dive, can you explain the difference between Medicaid and Medicare?
Yes, that's a great question. So Medicare is usually associated with that 65 or older group or individuals with disabilities. And Medicare specifically is offered as a federal aid. So that is usually the same cost throughout the country. Medicaid, on the other hand, well, it can go up to the ages of 64. And because it's offered by each state, the state has their own guidelines in which they put the cost at. There's not usually a cost associated with Medicaid. In comparison, Medicare usually have to pay a little bit of a premium.
Right. So Medicare, if I understand correctly, is generally for people 65 and older or individuals with disabilities. And Medicaid is generally for folks under the age of 64 who may be eligible, especially by income. For our listeners, you mentioned that Medicaid can vary according to the states. We're lucky to live in the state of Maryland, where we have expanded Medicaid eligibility. And pretty much most people who are very low income can be eligible for medical assistance. Now, you described the different healthcare programs within the health department. And can you give us a little more information about how they may be designed to help certain groups? Because I just discussed in the beginning that lots of or more of our younger residents in Howard County are uninsured, and these may include young families and pregnant women.
Of course. So the MCHIP program, it's actually the acronym stands for the Maryland Health Children's Program. So originally that was offered to, families, children, and now it's actually expanded. So we have 3 different tiers of insurance that you can apply for. There is the MCHIP, so that is for individuals up until 19. There's also the Medicaid for families, so those are individuals with dependents. And then there's also the MCHIP premium. So those who don't qualify maybe from the income guidelines, they're able to pay a small premium to be able to get access to their insurance.
And can you share a little bit about the new eligibility for pregnant women who may not yet be residents of the United States?
Yeah, of course. So just effective in last July, we had the Healthy Babies Equity Act. That's really exciting. That is for clients or residents who may not show as active residents of the state of Maryland or Howard County, but they're now eligible for Medicaid insurance throughout their pregnancy and up to 1 year after birth. That's a new enactment, and we're really excited about that because that's giving healthier birth outcomes for baby, healthier pregnancies for moms, and those mothers are actually offered the same exact services as anybody else with Medicaid. So those primary care appointments, OBGYN, and transportation, as well as immunizations and prescriptions and transports to pharmacies as well.
Awesome. Yep. We want healthcare to begin as early as possible, even before a new person is born. So we talked a little bit about eligibility, right? Like residency, or you don't have to necessarily be a resident if you are a pregnant woman. But how generally is eligibility determined? And who should people reach out to get in touch with if they have questions about whether or not they qualify or are eligible?
Yeah, so the eligibility is definitely a case by case, but that first, eligibility criteria we're going to see is that income level. So the income level in the family size. So if your income level within that FPL, the federal poverty level, then you'll be able to be eligible. And then your household size, depending on whether or not you're going to have that Medicaid for families or that MCHIP. And to discuss your eligibility options and see what coverage is best for you, you would contact the Howard County Health Department. That's the MCHIP program. And that phone number is 410-313-5845. And you can also come directly to the Howard County Health Department. We always have MCHIP staff here ready to assist or apply for Medicaid as needed.
And does staff speak multiple languages in case the person doesn't speak English?
Yes. We're very thankful. We have a very diverse staff here with multiple languages with the MCHIP program. So in addition to that, we also have language line, but truly we're very thankful for our diverse staff.
So if I come to the health department, do I have to just sign up once for Medicaid, or do I keep my coverage forever?
Yeah, so on that first initial coverage, you would get your eligibility information assigned by the MCHIP worker. And then every year we have what's called open enrollment. So that is when you would contact the health department, or the health department can contact you, and you would confirm your eligibility for that next year. Additionally, you would also update if there's any life changes. So any births, any marriages, deaths in the family, you would update. The coverage should stay active through that year unless there's any changes, but it's always good just to make sure your contact information is up to date. For example, right now we have the redeterminations going on. During the pandemic, everybody kept their coverage and there was no pause in it. Now we're back to pre-COVID, so we're doing those redeterminations again. They're coming out a little slower just because, we're brushing the dust off of COVID, but, we're still moving those right along. But yes, your coverage should stay active.
Okay, so it's important for someone who has Medicaid to renew annually to make sure they keep the benefits.
Yes, of course. And thankfully here at the Howard County Health Department, we do reach out to anybody. If you're coming close up to when you need to be redetermined for your eligibility, or if there's any questions, we have our database where we would contact you as well.
Great. Now, what happens if I come to the health department or call the health department and I find out I'm not eligible for Medicaid? Will you help me find other quality, affordable health insurance?
Yeah, so we actually have, as you touched on earlier, the HCAM, the Healthcare Access Maryland. We actually have a navigator here that works 2 days a week at the health department. So if you find that you're not eligible, based on income for the traditional Medicaid programs, then the healthcare navigator would be able to assist you in getting on a qualified healthcare plan. So those may be with an accrued cost with it, but there's still great healthcare plans throughout Maryland that you'd be able to access.
Oh, that's really awesome. So can you remind people, or why do you think health insurance is so important, especially for those younger listeners who, are pretty healthy, don't see themselves getting sick too soon, and may no longer qualify under their parents' insurance, or perhaps are unable to be covered by their parents' insurance?
Yes, definitely for the younger listeners, preventative care. I can say that over and over again. Preventative care is great. Also, with the health insurance, I think we originally think of our primary care doctors. There's so many more providers that are eligible under Medicaid, vision insurance, prescriptions. Truly, it is a wide range of services that you're able to get under your health insurance. In addition to being covered for Medicaid, with those 2 other Medicaid programs I mentioned in the beginning, the Administrative Care Coordination Unit, if you have a specialist or you have a child that has special needs, that ACCU program is really in your back pocket to be able to help you locate different specialty providers throughout the county. And then in addition, that transportation program too. If you are active for your Medicaid, that health insurance, that also covers your transport as well. So we're really trying to break down those barriers and getting clients and residents of Howard County healthy.
Scott, help with getting to the provider's office. That's really terrific, trying to break down those barriers. So again, for people that may be thinking about, do I need health insurance? I think you just explained why. I hope listeners, you've heard that loud and clear. What time of year or when should I start thinking about signing up for health insurance?
Of course. I mentioned the open enrollment. I don't want that to deter anybody, because truly you can walk in at any time and speak with any staff member here to review your eligibility for Medicaid. But definitely any life event changes. So if there's a birth, marriage, and then of course, always keep your contact information and your phone around you during open enrollment, just to give us a call and just to confirm if there's no changes, that's great. Then we'll go ahead and get you reviewed for the next year. And then if you have any changes, we'll go ahead and check that eligibility as well.
So just to sort of finish up with this section of the podcast, what is the best way to get started if I'm ready to get started? And I agree with you. The best time is right now. And so where does someone who doesn't have health insurance right now, where should they begin?
Yep. So that first step, you could either call that MCHIP department. So that's the Maryland Children's Health Program. And that phone number is 410-313-5845. Or you can come in and see us directly at the Howard County Health Department here in Columbia.
Well, thank you, Allison, for speaking with us. We're going to take a short break, and when we come back, we will be joined by Mr. Anthony Wisniewski, Esquire, the chair of the Howard County Board of Health and the chairman of Levanta LLC, the nation's largest Medicare quality improvement organization.
Put your phone on D&D, that means do not disturb when you're driving. And when you're going from point A to B, I need you to stay safe, please, so always sing with me. So put your phone on D&D, that means do not disturb when you're driving. And when you're going from point A to B, I need you to stay safe, please, so always remember this beat.
Don't drive distracted. A message brought to you by the National Highway Traffic Safety Administration, Project Yellow Light, and the Ad Council.
Hello, we're back. Thank you for taking part of your day to listen to the HOCO Health podcast. Now we're going to shift our focus to patient healthcare advocacy. As our county residents age, and our healthcare needs expand, understanding how to communicate with our healthcare providers becomes more important. As patients or caregivers, there are considerations to keep in mind as we juggle new doctors, new medications, and new health-related needs. Joining us is Mr. Anthony Wisniewski, who is going to discuss some of the questions patients should be asking themselves as they seek and receive medical care to ensure they are getting the high-quality health care that they deserve. In addition to his current role as the chair of the Howard County Board of Health, Anthony has served 2 terms as a commissioner of the Maryland Community Health Resources Commission. While there, he led a strategic pivot to prioritize healthcare grant funding for food deserts in West Baltimore. As chairman of Levanta LLC, he provides strategic direction to support the company's mission of advancing population health, improving patient care and safety, engaging in caregivers and other stakeholders, and effectively managing healthcare costs through quality improvement, strategic communication, and innovation. He has also served 4 U.S. presidents and 2 Maryland governors on numerous boards and commissions. Welcome, Anthony. Great to see you.
Thank you, Dr. Rosman. Good to be here.
So, Anthony, why is it so important for a patient to be the center of the medical decision-making process?
The reason is that person-centered or patient-centered care is, in fact, the gold standard for healthcare quality. In 2024, patients are supposed to actually guide the care they get. The old saying, doctor's orders, is just that. It's an old saying. Today, this is about informed consent, where in a patient-centric surrounding, patients more than a generation ago have now been elevated not only as the subject of the care, but a stakeholder in determining the care and ultimately the outcomes.
It should be a partnership, right? The patient and the doctor, not necessarily the doctor or provider, I should say, telling the patient what they think the patient needs. Is that what you're saying?
Yes, that's absolutely correct.
So that is sort of a paradigm shift from previous generations. So what we're talking about today is really important to empower us as patients in terms of our health care. So what should a patient do if they don't understand the treatment plan their provider is recommending? Because we know providers talk a lot of medical lingo that may or may not be familiar to some people.
Well, that's a great question, Dr. Rosman, because even though we're in the era of patient-centric care, a patient can still sometimes become a bit nervous or even forgetful when confronting a white coat in a doctor's office for an exam or a consultation. So in order for patient-centric care to actually occur, there needs, to your point, to be a keen understanding by the beneficiary, by patient. And that first and foremost includes an acute understanding of the patient's treatment plan. So if you don't understand your treatment plan, which still happens, you have the right to understand it first. You're empowered to understand. And you can do so by having your questions answered regarding your treatment. And if you still don't understand, or you need help in understanding, then you have the right to ask for it before you undergo any treatment whatsoever. You do not have to undergo any treatment that you do not want. So the bottom line, Dr. Rosman, is if you're a patient, you're going into the office, meeting with the physician, a surgeon, name your procedure, and you're uncomfortable, don't understand, ask. It's your care. It's ultimately your outcome because you're the recipient of it.
Absolutely. And what I recommend to people is if you know you have some questions already, write them down and bring them with you, because we all know sometimes a visit can be very quick. Sometimes you may get unexpected news and you may forget the questions you want to ask. So write them down and tell your provider that you have questions, because it's really difficult once the provider exits the door then to ask the questions. So write them down, and it's okay to even call the provider back if you have additional questions.
Yes, and Dr. Rosman, much to your point, in the last 10 years or so, there has been a new emerging profession called patient advocacy, where either trained clinical professionals or family members, laypersons that have undergone a certain amount of training in this domain can be your advocate. Attend the doctor's visits with you, interact, ensuring that the various sort of concurrent levels of care or medications that a patient is receiving are in fact received. Miscommunication historically has been something that has plagued the delivery of healthcare. So patient advocates, which I'm really glad to say is a growing, increasingly strong profession today, which may not have existed 10 or more years ago, is another resource for patients that would like, in fact, to have additional help. You have to retain these people to do this, understand, but this is an additional, line of assistance if you feel that you need it.
That's really important. So we identifying that there are professional patient advocates, but everyone can also identify their own patient advocate and bring that person to the office visit if they need assistance. I know recently I accompanied my older brother to surgery just to be his person, but also there in case he needed support to ask questions. And so, seek out your friends or family member who can also be that advocate if you can't get a professional advocate.
Yes, and further to your point, if I might, Doctor, you had introduced me as the chairman of Levanta, LLC, right here in Howard County. We are the nation's largest Medicare beneficiary and family-centered quality improvement organization. And what that essentially means as a contractor to the federal agency CMS, which oversees the Medicare program, this program seeks to elevate the role of beneficiaries' family, patient advocates as well, in ensuring that beneficiaries receive the best possible Medicare that they can. And when there's the perception or the reality that that care has fallen short, whether you've been hospitalized or you're a skilled nursing facility, or whether there's a quality of care complaint that requires immediate action, Levanta, as a Medicare, again, beneficiary and family-centered care QIO or quality improvement organization, is there to provide immediate assistance. And there is a hotline that of a loved one who's a Medicare beneficiary or the Medicare beneficiary, him or herself, can call to receive assistance anytime.
That's fantastic. And just as a reminder to our listeners, Medicare generally is for individuals who are 65 and older or who have disabilities. So it is really important that everyone understands how you may access help, especially if you're older or disabled. Now, specifically, what should someone do if they have concerns that their medications or the health care that they want are being denied? You mentioned a hotline and your company. What else should they know?
Well, in addition to just Medicare program, the hotline in Maryland is 1-888-396-4646. That will handle Medicare-related issues regarding appealing a discharge from a hospital, for example, or a skilled nursing facility. It will handle immediate quality of care concerns about the kind of care they're receiving in the facility, whether it be from the nursing staff, the cleanliness of the room, etc. And it also encompasses other beneficiary complaints that might be experienced when receiving Medicare medical care. Outside the Medicare domain, if a patient has concerns about new medications, first, the patient should know that when a new prescription is being issued, the patient has to remember, be mindful of the fact that both the doctor and the pharmacist, again, the doctor and the pharmacist have had to have discussed any potential drug interactions that may have occurred, namely when you're being prescribed medicine. In fact, medication mistakes are extremely common, and as we all know, they can be very costly to the health of the beneficiary. Bottom line is, if you, as the beneficiary or loved one of a patient, have any concerns about new medications and potential interactions, ask. Don't be afraid to be a squeaky wheel. Ask your doctor, ask your pharmacist, make sure the two of them are in agreement that this is the right treatment protocol.
This is very important information. And I, in fact, used the hotline and had a reminder yesterday about a medication interaction. So about a year ago, when my mother-in-law was going to be discharged from a facility and my husband didn't think that she was ready, he called the hotline and immediately got some help with that. So the hotline works. Yesterday, I was picking up a new medication that my doctor had prescribed, and the pharmacist came over and asked me about other medication I was taking and told me that there could possibly be an interaction. So I don't recall my doctor mentioning that. I'm a doctor and I didn't know that. And I was really grateful for that pharmacist to let me know about the potential warning and interaction with the new medication. So thank you for reminding and telling our listeners about these two important things, because we do have rights and we do have supports out there when things come up.
And Dr. Rosman, for those that require information to be communicated in a particular accessible format, that is also your right as a patient or a family member or caregiver to that patient. Accessible formats, including information translated to them for an interpreter, these are all entitlements that all of us have if in fact you need it.
You mentioned a few times, Anthony, quality and quality healthcare. What are the domains of quality healthcare, and why is it important for a patient or caregiver to remember these domains?
This might be the most important message that I can convene to your listeners today. There are the following domains. Healthcare must be safe. Healthcare must be effective. Healthcare must be person-centered, as we discussed, timely, efficient, and equitable. If the care meets these standards, then the care that you or a loved one is receiving bears the hallmarks of quality healthcare. But if it falls short of being safe, effective, person-centered, timely, efficient, or equitable, that is not quality care, and you should seek assistance.
Well, I think we're going to end on that because unfortunately we are out of time for today. But I want to thank our guests, Allison Hooley and Anthony Wisniewski. You can find more information about how to access affordable health insurance by visiting the Health Department website at hchealth.org or by calling us at 410-313-5845. You can also stay up to date on what's going on at the Health Department by following us on social media at HOCO Health. Thank you for listening to the HOCO Health Podcast. We hope you'll join us again this summer for a new public health topic. Have a great day, everyone.
Thanks for listening to Dragon Podcasts. Connect with us at podbean.com/dragonpodcasts.